It is a temporary worksheet written in pencil for ease in recording frequent changes in details of client's care. That means when the patient is admitted, she has some problem, and day after the admission, she maybe develop some new problem. So if you write in pencil, you can erase it and write the new problems. So it is for your easy writing and easy changing mode. So those cards are very short and small, and it is kept in drawer only. So whenever needed, nurse can find it. It is kept in alphabetical order, so that it will be very easy to find it out. And in that form, the identification data, diagnosis, nursing needs, intervention, whatever the medication, allergies, all those details are written in these cards. Flow sheets. It enables nurses to record nursing data quickly and concisely and provides an easy to read record of the client's condition over time. And graphic record typically indicates body temperature, pulse, respiration, BP, body weight. And intake and output record, medication administration. It includes the date of the medication order and expiration date, the medication name and dose and frequency of administration, route, and lastly the nurse's signature. And skin assessment record. It includes the skin injury, drainage, odor, culture information, and treatments. Progress notes. It provides information about the client's progress toward achieving the desired outcomes. Therefore, in addition to assessment and reassessment data, progress note include information about client problems and nursing intervention. The format used depends on the documentation system in place in the institution. Nursing discharge or referral summaries. Client and family involved in process begins from very beginning, from the day of the admission, and summary of the events whatever occurred in total time of the hospitalization, and may have own checklist. That is what you have done or not done. If you have a checklist, so easily identify that what is done or not done. And instruction written in layman's terms, not in medical terms, so that every person in the family can understand and can follow your order also. Client education, integral to process, that is food-drug interaction, what are the medication the client will have in the after discharge. So you must educate about the medication, so that food-to-drug interaction, drug-to-drug interaction, those you have to inform him. And rehabilitation reference for neuro patients and for psychiatric patients, it is very important for rehabilitation purpose. And medications, the importance of the medicine. What is the antihypertensive medicine or anti-diabetic medicine? If you don't know about that medicine, he will skip. And after that, problem will arise again he will hospitalize. So please tell them about those important medicines. And the disease process also. Nursing informatics. That is computer-based patient care record, assessment, care plans, physician's orders, and maintain confidentiality with passports, looking at other records, nursing information system, clinical information system, and electronic medical record. So here it is, the nurse keeps record in bedside. This side is bed and in this side is computer. So whenever she needs some recording, she can record. This is in nursing station. She record after doing the activities. Next is reporting. Reporting means communication between the health personnel mainly. What about the activities done in one shift, that you have to report for the next shift, so that the necessary omission or repetition of the activities will not occur. And other health professionals will also be aware of the activities, so that the patient's comprehensive care will be successful. Report can be oral or written, and it may be for the change of shift, and mainly it is for nurse to nurse, and it promotes the continuity of the patient's care during hospitalization. And report on client health status, care required for next shift, significant treatments and family issues, all you have to report to next sister. End of shift report. What we have called about handover takeover. Provide basic information about the patient, key professional, avoid judgmental language, include assistive personnel, provide exact information, include significant changes in client's condition, and clearly state the priorities of care. It may be according to the priority, and if you have any important handover, please tell at first or in the last, because first and last memories are kept in best. Otherwise, in middle, if you tell important things, it will be lost. And be concise. Telephone reports. Inform physician of changes. Client transfers to different units. Result reports from laboratory or radiology. Client transfers to different institutions, and information needed when call made, to whom, and what information you given. That is that to be recorded. And keep clear, accurate, and repeat information if necessary. Here one example. First you have to mention the date, then hours, then who giving you information, what is his designation, reported by telephone, that the patient's name, and what information he is giving. Bilirubin was 3.5 mg per dm, and who are you writing, your name and your designation. The person receiving the information should repeat it back to the sender to ensure accuracy. You have listened by telephone, so it is correct or not, you have to check it. Telephone orders, mainly physician to registered nurse. Physician must co-sign within 24 hours. Telephone order should not be left unrecorded. So it should be in the order sheet, and it should be signed also. It is only for night time or emergency orders. Don't practice in for routine time. And guidelines and procedure per institution. Be careful, precise, and accurate with order. So if you have any question, if you think the order is ambiguous, abnormal, or contraindicated for the client, the patient is having diabetes and physician is giving order of 5% dextrose or DNA, so you have to question that the patient is having diabetes, should I give the 5D or DNS, like that? You must question. Write order as said by physician and repeat it back, and write verbal order or telephone order. Date and time is very important, and physician's name also into the physician's order sheet. Next is care plan conferences. It is most important in today's sitting. Discuss possible solution to certain problems of a client. If the client is a complicated case, then one nurse may not assess the client successfully. So more than one nurse, 2 or 3 nurses can assess him, and there may be a conference like. It allows each nurse an opportunity to offer an opinion about possible solution to the problem. So here is some thought exchange. And other health professionals may attend the conference to offer their expertise. As for example, dietitian may discuss dietary problems of client who has uncontrolled diabetes, and the patient may also participate in this conference. Nursing rounds. 2 or more nurses visit selected clients, and each client